5 on your health this morning, treating a nagging pain in your calf. If rest doesn't do the trick, there's a chance it could be something worse than a strain or a cramp.
Here to explain is Dr. Miho Tanaka, Director of the Women's Sports Medicine Program at Mass General Brigham. Doctor, thank you so much for joining us in person this morning. We love picking your brain. We know we hear a lot of complaints, especially about calf pain. Is it usually easy to figure out what's causing that?
Yeah, so it's not always easy, but generally the way we think about it is that there's different categories of problems that can lead to calf pain. So the most obvious one is an injury, of course. An athlete will say, I was playing, I felt a sharp pain while I was pushing off. So that usually means it's something related to the muscle or the tendon. It doesn't always have to be an injury. Sometimes it could be after an increase in their workload, they start to have some discomfort. So we associate that with delayed onset muscle soreness. But there are some other things that can be a lot more serious than just an injury or some tendinitis. And so blood clots are one of those things. With a blood clot, you basically have a blockage of the veins in the legs, and that can lead to extreme pain, but also a lot of swelling, a lot of tenderness in the calf. And so if this happens, it is kind of an emergency, so it is important to get that checked out. And the other category is really things that are not necessarily coming from the leg itself. So people are familiar with the term sciatica.
Right, yes.
That leads to pain going down the leg. And the way that happens is that essentially there are nerves that go from your back all the way down the leg, and some of them to the calf. And if that specific nerve is pinched in the back, then you can have pain and sometimes numbness and tingling along that site, which can be at that calf. And so those patients will say sometimes that, when their back is in a certain position, or if they move in a certain way with their back, they'll have that pain. So it's really important to kind of think about what causes these things in addition to how it came on. That helps us to diagnose the actual problem.
Well, as you know, the Achilles tendon is back there.
Yep.
Why does it sometimes get sore? People say, oh, you're my Achilles heel, that kind of thing.
Exactly. Well, so the Achilles tendon is where the calf muscle connects to the heel bone. And so the way the muscles work is when they contract, then that brings the heel bone up. So that's how you do, you get up on your toes, or you do some sort of push off, like while you're running or jumping. And so when that tendency's overload, so if you're doing a lot, you're increasing your mileage while you're running, that tendon can become inflamed, and that's how you can get a problem like tendonitis. In other cases, you can have a sudden overload. So maybe you go out and you play basketball and you haven't done that, in a couple of years, and you suddenly push off in a way that you haven't, and then you can even tear that tendon. And that's a very dramatic event. When it happens, you feel a sudden pop, and it's really difficult to be able to move your foot afterwards. So if you do have that, it can end up with surgery in some cases, so it is important to get that checked out if that happens.
Can stretching help that?
Absolutely. So stretching is good for everything. Even if the problem is not related to the muscle itself, generally if you're having pain in your leg, your muscles are going to tend to tense up. And so stretching can help relax that and just give you some symptomatic relief. But as I always say, it's not just about stretching to treat the problem. It's really important to stretch as a preventative measure, so before and after exercise. And the way that this works is that, the muscles need to be flexible in order to adapt to explosive type movements like running or jumping. And if you don't have that flexibility, that's when you're going to end up with a muscle strain or even a muscle tear. And so doing this to prevent injury is just as important as treating it.
I'm glad you said that, because sometimes you feel like it's a waste of time to stretch before. Like, I only have a little bit of time. I just want to get the run in, but that could be your last run if you don't do it, right?
That's right.
Dr. Miho Tanaka, Director of Women's Sports Medicine Program at the Mass General Brigham. Thanks again for coming in this morning. We love your information.
Thank you so much, Doctor. Very nice to see you.